MediGroup Physician Services presents MediGroup's 5 Questions in 5 Minutes with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Stacey Goodale, National Account Manager Specialty with GSK. Now, here's your host, MediGroup's Frank Gillespie.
Thank you very much. And welcome, Stacey. And
good morning.
Yes, it's great to have you here, and we really appreciate it. Thank you very much. So, Stacey, I'm going to get right to the questions. How long have you been in this role for GSK?
So actually, in this particular role, this is 14 months. So once the pandemic started is when I took the national account role.
Oh, my goodness.
With GSK, this will be starting of my 20th year with GlaxoSmithKline.
Well, congratulations. That's very neat.
Thank you.
Absolutely. I'm curious, too, is GSK still also referred to as GlaxoSmithKline, or has the name morphed over time and it's officially GSK?
I think, GlaxoSmithKline is a UK-driven company. So from a global perspective, we're known as GlaxoSmithKline. As you verbalize that to people, it's a mouthful, of course. So then it gets shortened in our acronym. Really, when you look at the New York Stock Exchange and people refer to it, it's easier to say GSK. So that's where it gets shortened to GSK. But as a company, Glaxo Wellcome merged with SmithKline Beecham, and that's where the two companies came together.
Fascinating. I've heard of all of those companies in my career, but that little bit of history you just shared is fascinating. Thank you very much.
Yeah.
Excellent.
You're welcome.
So, Stacey, as a national account manager specialty with GSK, what do you specifically do for GSK and its customers in general?
Okay, so my previous role, I was a contracting manager, and then this morphed in because of the need actually of the customer. So with a company like MediGroup, you guys have a lot of specialty customers that you deal with in the United States. You don't fall into that you're a health system or you're a non-acute or acute side. So one of the things I do is that I look at all financial analysis of vaccines, and I figure out a way to have specific and special contracting solutions for customers and companies just like yourself at MediGroup. We're able to not just cookie cutter create contracts. As you'll see, we've got a variety of contracts that work for everybody, and it just makes it, and so that's why it's called the specialty division of the National Account Management team.
It makes perfect sense, and I got a feeling for that a little bit yesterday in the call that we had with some of our partners.
Yep.
So, and it was very interesting to see how that all comes together, and you were talking about certain groups. So I appreciate that background there. So, Stacey, what are some things that GSK specifically changed or modified in its practices and customer service during the pandemic? Are you seeing any changes in those modifications now that the vaccine?
Yeah, if we reflect back over the last 14 months, I think the first thing that comes to mind is adaptability. So, everybody was learning how to do business in our new model versus just sitting around and doing nothing. So a couple of things is that our company was able to really ramp up the option of electronic resources. Mm-hmm. We actually had 3 platforms that were launched with the Zoom. We've got WebEx, and then we have Microsoft Teams. So no matter where the customer is and what platform they have, we're able to morph into that. We also had, now that we're moving back face to face, it's good for us and it's good for the customer. They want to see that. You can see that on their face. But the pandemic really taught us how to be adaptable to continue to move business forward and find solutions for our customers.
Great explanation, and it's exactly true. We experienced the same thing here on the MediGroup side as well. So, and what we're doing today through this effort on the Zoom right now is a reflection of what I think the adaptability and what we learned from the adaptability. And I think this is a morph.
Probably every business in the world had to do that if you were going to survive.
Absolutely.
You had to find some way, just like restaurants besides the medical facilities, you had to find some way to survive.
Absolutely. Well, Stacey, what is an emerging care trend that you see impacting the health system supply chain today?
So I think one thing that's really come to the forefront over the last 14 months is drive-through clinics. So drive-through clinics and virtual care. And there have been great positive aspects to that as a trend, figuring out how they can navigate that to, one, follow the CDC guidelines to make sure that we get everybody from birth all the way to seniors, get them vaccinated. On the flip side, there is challenge with that because you've got patients that, Seeing them virtually, you don't really get to talk to them and listen to them about their mental health, about their weight, about their diabetes and heart failure. You miss that kind of gap. So as well as it was a great thing that they adapted to bring virtual care in, they were able to still monitor them somewhat. But I think getting back to face will be, and it will be a fine balance. It's a great thing, but you cannot be face to face when you're taking care of patients.
Very, very well said. And I know the advance of telemedicine has really had an impact this past year. I know we've done a couple of contracts with telemedicine, and it's amazing some of the things that the telemedicine and the apps can track and do, remote patient monitoring. So all of those tie in, I think, to what you've indicated. So appreciate that. Right on cue. Okay, the last question. What do you see as a key difference between servicing the acute care supply chain versus the non-acute care supply chain?
Okay, great question. And really, since I've done both, and I do cover the entire United States. So when you come from systems to a specialty division, the one thing that is dramatically different is standardization. So in the acute space, everything is standardized. You've got a set of gloves, you've got a formulary for medicines, you have a formulary for vaccines. Here's the contract because it takes volumes, and that's the way they're used to looking at things. When you add in the non-acute, if the hospital system owned them, they would fall under that and they get the benefit of being with the hospital. When you get to a section of business like a MediGroup, who is really taking care of all non-acute, you wanted to be able to find a way to give them the best discounts as the same thing as a hospital system. So you have a very multiple sites, you have multiple people running their business, and you have a lot of opinions.
So
whereas in the hospital, it's kind of driven from a medical director to a chief purchasing officer and the CFO, and it kind of drives down a funnel. So doesn't mean that it can't be done, but I think standardization is a little bit simpler. And I think what you'll see from GlaxoSmithKline from the vaccine side of this business unit is that we have gotten creative to find solutions for that non-acute so that they do have buying power, just like those hospital systems.
And organizations like MediGroup well respect that and recognize that and appreciate that, and our members do too. Yeah. Well, Stacey, it's been 5 questions in 5 minutes. I think it's probably a little longer than 5 minutes, so I appreciate you taking the extra time. And
thank you for having me.
Absolutely. It's always a delight to see you, and it's always a delight to work with you. And I know we have some initiatives potentially going on in the background, so I look forward to circling back on those and working with you further. So again, thanks for your time today.
Have a great day. Thank you.
You too. Talk to you soon.
Bye-bye.
Bye-bye.
This has been MediGroup's 5 Questions in 5 Minutes with Healthcare Executives, produced by Bridget Wilson and Carrie Peters and hosted by Frank Gillespie. Special thanks to Stacey Goodale, National Account Manager Specialty with GSK. This has been a presentation of MediGroup Physician Services.